All right, y'all. So back again with Zach in California at Stanford. Once again, he is the orthopedic resident out there. It's the first week of November. So as I mentioned in the first video, Zach was with us for, kind of going to be keeping up with him every month so we can kind of see his progress, see how he's feeling about everything. I know since we talked last, my schedule's gotten a lot busier, and last week's reflection was that this is going to be a long and tiring year, but that it's all been worth it so far. And I know I'm going to say I still feel that way. It's a lot, but the more I get into it, the more excited I am about it, and the more I can't wait to keep going. So without further to listen to me babbling, let's get into Zach. And so Zach, how you doing? How's your month been? Just kind of give us a general update of what's been going on in terms of the residency, how your schedule's changed, how you're feeling about it, what's been challenging, what's been not so challenging, what's been exciting, all that kind of good stuff.
Yeah, sure. So I'd certainly second a lot of the feelings that you're feeling as well, in regard to just things picking up and kind of getting full steam ahead pretty quick. I would say they did a pretty good job of kind of easing us in here. So it was like slow progression, kind of a couple evals a day. So we're slowly starting to build our own caseload. But more so recently, here we have an overlap of last year's residents are here for a month when we come in, which is awesome because that they gives us extra mentor time. So they spend extra time with us and kind of help us get used to the system, sit in on evals, that sort of thing with us. And then we also spend time shadowing them. But having said that, this past week was their last week. So really this week was kind of the first time that I took on a lot of my other like co-residents, past patients. So my schedule kind of went from lots of green to having to discuss with patients when the next available time they can come in is, because it filled up pretty quick. But it's been nice to kind of get in a flow in that regard too, because there's not as much downtime per se. It's more like from one patient to the next, moving right along now. So certainly hopped right in, but like you said, just kind of excited to keep going. And other big things, I've had a couple, I think this upcoming week would be my third week of mentoring with my specific content mentor. So I kind of have a primary, which is like I can go to for anything, and then a content one that I have 5 specific hours like set aside each week. So they've been sitting in on a couple evals with me, and it's kind of nice to see a lot of that just progression early already, just kind of after one eval, kind of discussing it, rehashing it, and then going in and attacking the next one and seeing that improvement pretty immediately.
Yeah, that's awesome. I know, like, kind of like what you were just saying with that early improvement is kind of like just even after a few mentor sessions and getting some more involved with some of the on-site didactic information that they're giving us, like in terms of movement sessions and kind of just like clinical pearls, it's kind of like, wow, you can already start to see a little bit of progress in your own clinical practice within a couple of weeks. So I know it makes me real excited for the next year, because it's like, if I feel like I'm already improving within a couple of weeks, and it might be small changes, but it makes me feel good, and it makes me feel like I'm on the right track.
Yep.
What would you say is like your general overall mood if you had to give it like 1 to 2 sentence, maybe 3 sentences on like the past month, kind of how you're feeling about everything? Is it super manageable still? Is it getting a little tougher to manage? Are you overwhelmed, tired, still just green and super energetic? And I'd love to hear your thoughts on that.
Yeah, so I'm definitely, I mean, I'd be lying to say if it hasn't like beat me down a little bit already, but I also knew like coming into it that that was part of it, and just having so many different viewpoints from so many different therapists reflecting that back on yourself and kind of trying to pick out like what you want to take from each therapist. I feel like recently I've gotten a lot more of that, just being um, able to shadow a lot of other therapists and being like, wow, that's really cool what they do, but I probably wouldn't do that. Or like, wow, they're really cool focusing on like movement in this way. I would like, I want to incorporate that. So
Yeah.
um, it's been a lot of like trying to tease out what the really cool things that I've seen other therapists do, and then try and start to formulate that into my own practice. So I would say it's definitely been a lot more tiring recently. A little bit later nights finishing like documentation, that sort of thing, because just the sheer volume is picking up. But overall, I would still say that pretty full steam ahead, like super excited. But just because I've seen, like you said, the improvement so quick that I think we both knew getting into this that it was going to be a long, hard year, but like 13 months later, that the clinicians will be kind of thing, as compared to when we came out of school, is going to be exponential.
Yeah, no, I would agree with that a lot. And I know one thing, kind of since we talked last, I've started working a lot more with some of my OT counterparts. I know that might not necessarily be something that you're going to have to deal with as much just because you're primarily outpatient, but
Hmm.
and kind of like getting to learn a lot more about what they do and kind of getting just to learn from some of their clinical pearls of, you know, they've been practicing maybe 4 or 5, 6 years in acute care where I am right now, and just like kind of learning things from them and learning how to co-treat a little bit better. I know that's been exciting for me, but I would definitely second the um, getting busier and getting a little bit more tired and getting to bed a little bit later. Um, so I think that's kind of the hallmark sign of we're actually getting into the meat of the residency. But it sounds like you're still pretty optimistic about the weeks to come, and it hasn't beaten you down too much yet.
Yep. Yeah, and a lot of the like extra lecture material stuff that we're having, um, it never seems like a burden to go to those things. Like it's so interesting, and you can just tell that the people presenting it are really experts in it. And it's like not everything that like new stuff that we haven't heard before, but it's taking it like from a 10,000 viewpoint and like zooming way in on it. So it's like just further enhancing what we already know with like updated research and just like from experts in the field. So like we've been going 6 days a week the past couple of weeks because we'll have lectures on Saturday as well. Today was actually the first Friday that we didn't have one in the afternoon, so I got off a little early this Friday. But um, it's not like something that I dread, which is good. I mean, since I'm decided to do this and everything and in it for the long haul, but it's something that I honestly like look forward to. Like I read the topics and I'm like, wow, I look forward to that lecture kind of thing. So just further reassuring to me that I made the right decision kind of thing.
Yeah, yeah, we have. I know we have. I kind of mentioned it already. Movement sessions with. She's like our residency director, and she's owns her own practice and has been practicing forever, and is, you know, multiple chapters and textbooks and a few textbooks out on movement analysis, and just like learning her clinical pearls on facilitation and just kind of like how to use your hands. And we had one today, and we got done with like the first section, and I like looked at my watch and realized like a whole hour had gone by and I had no idea. I was like,
Hmm.
I'm pretty sure we just started. And
Yep.
I had to do like a double take, but it's nice to have that and feel like we're, you know, it's information that we really want to learn. And it's exciting because like you said, you know, you start to really look forward for those educational opportunities, and being able to grow and just keep learning and keep applying. And it's nice to be in the middle of all that while still in having a lot of time in clinic,
Hmm.
because then it's like you can directly go and apply it like within a day or two to like real patients, not mock patients or other students.
Yep. Yeah, no, that's one thing that I've noticed that they've done a real good job here thus far is they correlate kind of the patients that they put on our schedule as far as like new evals with the material that we're learning. So like recently I've had a lot more low back people, and like this coming weekend is our lumbar exam evaluation lecture, and so they kind of tailor what we're doing in lecture very well to, like you said, transition it right into the clinic. And I
Mhm.
think that's kind of the nice thing about the whole didactic component is you get both, where it's like in school it's hard because you're out of the clinic for so long and you just get like in the mindset of school, and it's almost like you forget how to be in the
Mhm.
clinic again.
Mhm.
um, but yeah, it's nice having the balance of both during like residency.
Yeah, it's funny you mentioned that. Literally yesterday, I had a patient who was like 5 days post stroke, and he was completely flaccid in his one upper extremity. It was the first patient I've seen that was completely flaccid in an upper extremity, and it's like obviously with rolling and getting him up and out of bed, it was a little bit of how am I going to manage this extremity that they have no control over in into moving these. And then today our session was on how to manage a flaccid extremity during movements, and I was like, oh,
Yep.
good. This would have been nice to know yesterday, but
Yep.
now next week when I go into clinic, I'll be able to put that into practice. So I think I would second that. All right. Is there anything else from the past couple weeks or month that you want to share, or you feel like has been tough, exciting, or any final thoughts?
um I think just one cool thing, I guess, is that just the variety of people I've got to see thus far has been pretty like exciting, and also kind of keeps me on my toes because you can't really like get in a rhythm. So
Mm-hmm.
I've kind of had a good mix of like some post-op because of COVID so much. Like we've had a ton of post-op since they were all the elective surgeries were canceled initially. So a lot of those are like happening now. Um, but it's also a good mixture of like non-post-op, just where you got to use more clinical reasoning to determine what's going on. So I think that's been a really good balance and something that's been helpful for me to just kind of keep me on my toes of what's next.
All right. What are you looking forward to most for November in terms of the residency and being in clinic?
I think the continued like shadowing of other therapists too, because that is something they've built more in recently, is they're having us sit in on evals with all the therapists. So it kind of gives like another opportunity to, it's one thing to just observe them in the clinic, but then they kind of like sit in on eval and see how they like get the process going has been pretty awesome. Um, and honestly, not this Saturday, but next Saturday, we have our exercise physiology lecture, like big one all day Saturday, but I'm actually really excited for that.
Sweet. All right. Well, good luck the rest of November, and we'll have to hear from you in the beginning of December. See how things are going. Thanks for coming on and sharing a little bit about this past month.
Yeah, sweet. Sounds good. Thanks for having me.